sweet potatoes can be considered a superfood, one of the healthiest vegetables on the planet, and one day perhaps even off the planet, as NASA has chosen it for space missions. One of the healthiest and cheapest. The study aimed to identify which vegetables provided the most nutrients per dollar. If you look at a graph of affordability versus nutrition, you can see that the healthiest foods, like dark green leafy vegetables, may also be among the cheapest, and the highest nutrient-rich food scores per dollar were obtained for sweet potatoes. They're not just packed with nutrition, but may have special cancer-fighting properties. In 1931, a unique protein was discovered in sweet potatoes, later renamed. 80% of the protein in sweet potatoes is a type of protease inhibitor with potential anti-cancer effects. It was originally tested against leukemia cells and appears to suppress the growth of leukemia cells in a petri dish, but how would a sweet potato protein ever get into our bloodstream? As soon as most proteins hit our stomach, they start getting digested. So they tried sweet potato protein against tongue cancer. Sweet potato constituents certainly come in contact with our mouth. Tongue cancer is often treated with chemo. However, most of the chemo drugs for tongue cancer have great aversive side effects, so it is indispensable for us to find other therapeutic strategies. Sweet potato protein rapidly diminished viability of the cancer within a matter of days, leading them to propose that sweet potato may be useful for human tongue cancer, but presumably not much else. Remarkably, though, this class of proteins doesn't just survive digestion, but may be absorbed into the bloodstream intact, in at least 2 of the 9 women with advanced cervical cancer they tried giving it to. So, most recently, it was tried on colorectal cancer cells, one of our most common and deadly cancers. Normally, we just surgically remove the colon, but that only works in the early stages, since there are often micrometastases outside the colon that can subsequently lead to cancer recurrence and death. And so we've started searching for anti-metastatic agents. And not only does sweet potato protein slow down the growth of colon cancer cells, but decreases cancer cell migration and invasion. Though sweet potato consumption has been associated with lower gallbladder cancer rates, it's never been directly put to the test. But what's the downside? From a recent review on diet and inflammation by Dr. Leo Galland, who, when I was a kid, actually used to be my doctor. Inflammation has recently emerged as an important aspect of the development of age-related infirmity and the major chronic diseases of industrialized societies— heart disease, diabetes, Alzheimer's, cancer. And we have markers of inflammation now, like C-reactive protein, which are easy to measure and give a sense of how much inflammation there is in our bodies, which is predictive for the development of some of these diseases. We know plant-based food in general have anti-inflammatory effects, particularly fruits and vegetables, but not all plant foods. From a 2010 review, extra virgin olive oil decreases inflammatory markers compared to corn oil or non-virgin oil. Tomato juice helps, but raw tomatoes don't appear to. Walnuts, red wine, and flax meal work. Garlic powder doesn't. Mixed data on tea, but sweet cherries do seem to decrease inflammation. There have since been a few new studies to add to this list, one showing that those eating just 4 servings of legumes a week— lentils, chickpeas, peas, beans— dropped C-reactive protein levels a whopping 40% in 2 months. And then, apparently the first study ever to address the effects of potato consumption on oxidation and inflammation in humans was published. And not just any potatoes, there's all sorts of new varieties out there. First, though, they looked at regular potatoes, white russet potatoes. 1 steamed potato a day for 6 weeks. Inflammation, as measured by C-reactive protein levels in the blood, tended to go up. Next, potatoes with yellow flesh. did a bit better, but neither were significantly different than baseline. Only purple potatoes, potatoes with purple flesh, significantly decreased inflammation. And same thing was found for oxidation. In this 2012 study, within hours of consumption, purple potatoes increased the antioxidant capacity of one's bloodstream, whereas white potato starch appeared to have a pro-oxidant effect. And purple potatoes also appeared to help lower blood pressure in folks with hypertension. They put people on 6 to 8 small microwave purple potatoes a day, and concluded purple potatoes are an effective hypotensive agent and lower the risk of heart disease and stroke in hypertensive subjects without weight gain. Combined with a reduction in inflammation and DNA damage, purple potatoes offer consumers an improved nutritional choice in potato consumption. What about sweet potatoes? Bad, or good? They're not good, they're great, ranked as one of the top 10 healthiest foods on the planet by the Mayo Clinic. So, sweet potatoes good, white potatoes bad. If you insist on continuing to eat white potatoes, peel them, as that removes about 3/4 of the toxins.